Hi, this is John with Diabetes You Can Win, and I'll be going over some exercises today included in an at-home chair exercise program. This exercise is the chest press. This exercise targets muscles of the chest, shoulder, and upper arm, including the pecs on the chest, the front deltoid, which is on the front of the shoulder, and the triceps, which are on the back of the arm. The American College of Sports Medicine recommends 2 strength training sessions per week with at least one set of 12 to 15 reps per major muscle group. These workouts can be included in 150-minute weekly recommendations for moderate intensity physical activity. Please also consult with a medical professional before beginning any type of exercise program. Paying attention to symptoms such as shortness of breath, dizziness, fainting, excessive pain or discomfort, and immediately discontinue the exercise program and seek medical attention if you experience any of these. For the chest press exercise, you'll grab each handle with each hand, wrap the band around behind you, slightly below the shoulder blades. Allow the band to go over the top of the arm. Lower the hands till they're slightly in front of the armpit, with bending the elbow, and then straighten the elbow back to the starting position, and then repeat from there. Again, making sure to stay tall, head up, feet flat, sitting at the edge of the chair to maintain an upright position to allow the band to stay in one spot during the exercise. And then again, paying careful attention to be very slow and controlled with both the pressing away and then lowering the band back to the chest to prevent the band from rolling up the back. So if you're looking to make the chest press exercise a little easier, of course you can always do it with no weight in terms of just getting used to being able to hold your arm straight out in front of you. You can also add a small implement, whether anything small weighs a couple pounds. Just going to show with the Diet Coke cans here what that would look like. Something you can hold in your hands, or just kind of build up some of the muscles there in order to get to where you can use the band. And then if you're looking to make it a little more challenging, when you come back with the band, as you go back around on the shoulders, you can grab the band instead of the handles. That should shorten the length of the band, make it a little more challenging. Again, maintaining that same position and movement. And then you can also choke up as far as you can in terms of what your strength will allow you to do. And then you can also move into what's also called a chest fly. So again, starting with the easiest positions with the hands on the handles, letting the arms come straight out to the side, and then pulling back in. And you want to think about like you're giving somebody a nice big hug at the top. Over here. And again, of course, like with the press, you can also move your hands onto the band, and you can make this a little more challenging. Exercise that you could do. Also, you can customize the difficulty on this one a little easier without having to move the band around a whole lot. You could do this single arm. So again, the arm that you're going to start with, you're going to have the hand in the handle. You'll loop the band around the back just like you did in the chest press. And then you're going to grab the band with the other arm, but it's just going to hold the band steady from there, and it's not going to move. So then we're just going to press with one arm through here. And again, I can shift more band in here and choke up with the non-working hand, and that's going to make it more difficult. And if you get to the point where it's too difficult, again, all you got to do is just release some of that band towards the working hand, and that will make it easier. And then also, if you have the ability, if you have a high back chair, like I have this office chair, which will work, it's definitely not ideal, but we can show you how this is going to work. You're going to put the band around the outside the back of the chair. Make sure the band's secure before you lean forward, but then we're going to scoot forward the end of the chair, and that's going to allow me to stretch the band a little bit and make it significantly more challenging than looping it around my back, because I've really shortened the band and really increased the resistance. And again, I can scoot. The more I scoot forward, the harder that exercise is going to be. And then again, the opposite is going to be true if I scoot backward, it'll be easier. Just make sure that when you're setting the band up, you want to make sure that you have a high enough chair that it's not going to roll off the back of the chair and pop in the back of the neck. This chair works pretty well because it's stuck kind of in a reclined position. But just make sure the band is anchored really well before you get. Thank y'all for tuning in and watching. Please feel free to leave a comment. You can also get in touch with us at info@diabetesyoucanwin.org. We're also on Instagram, Facebook, and LinkedIn if you search for Diabetes You Can Win. You can also visit our website at diabetesyoucanwin.org, where we'll have more information regarding diabetes prevention, management, and treatment, with educational materials as well as different activities and community outreach programs that we're currently participating in. You can find links of all of our web pages down below in the video description. And we look forward to hearing from y'all, and y'all stay strong out there.